I believe that fungi could play a role in the development of ALS. That might sound unusual, but my story offers clues that point exactly in that direction. In 2021, my life fundamentally changed due to an illness that no one could properly diagnose. And today, I want to write about what I experienced, what I discovered, and why I believe there is a connection between ALS, the immune system, and fungi. The beginning. It started in 2021. I had symptoms that many ALS patients describe: muscle twitches, muscle pain, and cramps that felt like electric shocks in my muscles. Initially, my EMG, a test that measures muscle activity, was completely normal. A year later, an EMG showed chronic signs of denervation in all muscles. I also developed foot drop. All of this happened without a diagnosis. Every other possibility was ruled out through extensive testing. But I'm still here. And I believe there's a clear reason for that. I'd like to explain it to you. First, therapy and strange effect. In the beginning, I suffered from severe anxiety attacks. I was prescribed mirtazapine, an antidepressant, and it helped. But not only psychologically, also physically. The muscle cramps almost completely disappeared. At first I thought, sure, it's the medication. But by now I'm convinced mirtazapine doesn't just act on the psyche, it also influences the immune system. It activates certain signaling molecules that help fight pathogens, and that, I believe, suppressed the real trigger in my case. A fungus. Initial improvement, then a relapse. Back then, I didn't know any of this. I had almost a full year of relief. The muscle pain and twitching were barely present. The 4 things that helped during this time: I took probiotics. They significantly reduced the muscle twitching. The twitching only returned when I had an irritated gut. That was the first time I wondered, what does all of this have to do with the gut? Then I tried nicotinamide riboside, and suddenly the muscle pain vanished. My strength returned. Just like that. Previously, even minimal exertion led to days of muscle pain. I also took Tudka, another substance that studies suggest may help with ALS. I took both substances in high doses after an EMG in May. 2022 showed signs of nerve damage in all muscles. By July, the only noticeable issue was the foot drop. And, of course, I had been taking mirtazapine from the beginning, which, as mentioned, prevented the muscle cramps and stimulated the immune system. Then in 2023, I developed gastritis and had to stop taking mirtazapine. Soon after, in early 2024, I underwent a long course of antibiotics, and all the old symptoms returned. That's when it became clear to me, this must have something to do with the digestive tract. The real cause? I suspect that I have both an immune deficiency against fungi and an immune system misregulation, possibly a T-cell mediated cross-reaction, as described in some autoimmune diseases. Something similar was observed in 2023 with Crohn's disease and the yeast Candida. When the fungus grows in the gastrointestinal tract, the immune system becomes active and mistakenly attacks motor nerve structures as if they were infected with the fungus. 2 things play a role in this. 1. The toxins produced by the fungus. 2. The autoimmune reaction triggered when these toxins attack nerve structures. These mycotoxins enter the bloodstream via the stomach and intestines, and can cross the blood-brain barrier and the blood-spinal cord barrier. They reach the central nervous system and trigger inflammation there. The body thinks, here's the fungus, and begins attacking its own nerves. The aha moment. Nystatin. After the antibiotic treatment, I asked myself, what could be in the gut that gets worse after antibiotics and brings back my symptoms? Fungi. I went to the pharmacy and got Nystatin, an antifungal drug. After just the first dose, I felt it. The muscle tension immediately eased. But shortly after taking it, I also felt a strange burning sensation in my spine. Today, I believe this was the fungus reacting, releasing toxins because it was under attack. The fungus released so many mycotoxins that it temporarily paralyzed the immune response to the nerves. After this intense reaction, it was clear to me the fungus is real, and it's in the stomach, gut. Scientific support. Soon after, I came across a paper by an American doctor, Dr. Ride. He suspects that ALS can be triggered by fungi or their toxins, and all the patients he studied also had an immune deficiency. A strange turning point, the cold. Then came the strangest moment in my story. I had a severe cold, and suddenly all the symptoms disappeared. No more twitching, no cramps, no pain. It was as if someone had flipped a switch. Since then, the symptoms have not returned. I suspect that during this time, the fungus was able to spread massively, and its mycotoxins increasingly suppressed the immune system, interferon gamma. As a result, the autoimmune reaction against the motor neurons probably came to a permanent stop, not just during antifungal treatment. Since then, it takes me weeks to recover from a common cold. The skin reaction on my hands to the mycotoxins stopped. All signs that my immune system is no longer functioning properly. I also experienced stabbing sensations like needle pricks in my limbs, had herpes on my lips for the first time, and developed several styes on my eyelids. All further indications of immune deficiency. The fungus reacts. Always, I believe the fungus is still active and continuously producing mycotoxins. These mycotoxins permanently suppress my immune system. It reacts immediately to anything that promotes its growth, like sugar and carbohydrates, or anything that stresses it. Nystatin, herbal antifungal agents, caprylic acid, monolaurin, pterostilbene, berberine, sucralose, tea with spices like cinnamon, turmeric, or licorice root, cola due to its pH, psychological stress. I tried many things like coconut oil, herbal compounds, everything that studies suggest might work against fungi. But with every remedy, I felt the same reaction. The fungus fights back. It releases toxins, and that is physically noticeable. The setback. Even mirtazapine, which once helped, no longer works like it used to. I believe there was a time window in which the medication, or rather the immune system it activated, was able to keep the fungus in check. Now the fungus has grown. Mirtazapine still stimulates my immune system, and the fungus responds by defending itself with mycotoxins. Unexplained weakness. My EMG is now almost back to normal, except for the persistent foot drop. And to this day, no doctor has been able to explain where this weakness comes from. In 2021, the EMG was still completely unremarkable. The first abnormalities only appeared in 2022. Even the MRI showed no findings. No one has been able to explain why my heart rate goes up to 214 beats per minute at night after drinking alcohol. My theory, because the body is sedated and doesn't wake up properly if nerve signals to the lungs are impaired. I often notice that my swallowing reflex would just stop. Maybe it's similar with the lungs. No one can tell me where my twitching, cramps, and pain are coming from. And no one could explain why my immune system no longer functions properly. What it really is. Until recently, I barely had any typical ALS symptoms anymore, but instead signs of an immune deficiency caused by fungal toxins. Because my ALS-like symptoms are likely autoimmune in nature, they almost completely disappeared once the immune system weakened. The muscle tension is gone, but the inflammation in the central nervous system is not. Labs and test results. I had my immune status tested 5 times, once per month. And except for the first test, my T-cell activity was significantly reduced each time. One result was especially striking. A key immune marker was drastically lowered to less than 1/5 of the normal value. CD25, the IL-2 receptor, was down to just 2.5. The normal range is 14 to 23. My T-cell count was also 50% below the reference value. During the first cold, immune activation was still high. But with the second cold, it remained abnormally low, still 50% below the reference range, despite severe symptoms. At the same time, styes appeared on my eyelids. Mycotoxins in the urine. I also tested positive for elevated trichothecene mycotoxins in my urine in 3 different samples. One sample was taken after over 32 hours without eating, which tells me the toxins did not come from food. They came from inside my body, likely from a chronic fungal colonization such as Stachybotrys or Fusarium. Stachybotrys is a mold that grows in damp basements and produces these toxins known as trichothecenes. I played drums for months in a mold-infested basement and developed strange pustules with black dots in the center on my hands from the drumsticks. My circular hair loss, alopecia areata, also began during that time. Family connection. There are several autoimmune diseases in my family: vitiligo, alopecia areata, and chronic inflammatory bowel disease. I myself have alopecia areata, round patches of hair loss, also autoimmune in origin. And there are now studies showing that a genetic immune deficiency against fungi can trigger exactly these autoimmune conditions. That means a weakened defense system against yeasts or molds not only enables infections, but can also cause the immune system to attack its own tissues: skin, hair, gut, and even nerves. Because the immune system, due to the genetic defect, fights back with other tools like monocytes, which have been strongly elevated in my case for a long time. And this overreaction leads to autoimmune disease? My sister also tested for highly elevated Fusarium toxins in her urine, though not the T2 toxin. She had other variants. The question I keep asking myself is the T2 toxin particularly capable of reaching the CNS or causing damage there? Recent developments and new insights. About a month ago, I noticed a new reaction in my body. After each suspected toxin release, my eyes began to water heavily and the skin on my eyelids felt irritated. Shortly after, the lids would swell and styes would form. To me, this was a clear sign that my first line of immune defense, the mucosal barrier, was weakened. Then, a boil developed on my index finger, the same finger I often use to rub my eyes. The boil healed twice and came back a third time. This also shows how weakened my immune defenses have become. At the same time, I started taking a so-called biofilm disruptor, a supplement meant to break down the protective shield of microorganisms. After about 2 weeks, I felt strong pulling sensations in my stomach. It was working. But at the same time, there was a massive relapse in my muscular symptoms. The muscle twitching returned. And even worse, the muscle pain spread throughout my body again after more than 3 years. Into my eyes during swallowing, in my arms, shoulders, neck, and fingers. A new realization for me: whenever TLR3 receptor activity, a part of the innate immune system, is reduced, for example through fucoidone or omega-3 fatty acids, which studies show inhibit TLR3, the muscle symptoms return, even with biofilm disruptors. As long as TLR3 is active, muscle tension stays high. The immune system actively reacts to the fungus, but once TLR3 is inactive, the tension drops, and muscle pain comes back. My theory: the fungus triggers an autoimmune reaction that causes tension on the motor neurons. The more fungus there is, the stronger this reaction becomes. The less fungus there is, the less tension, and the muscle begins to degenerate. After the antibiotic therapy, when the fungus likely grew rapidly, my symptoms were at their worst. Probiotics apparently activated my immune system and caused the muscle tension as a response to the fungus to return strongly. This leads me to a bitter realization. When the fungus in the gut is attacked and starts to disappear, the muscle tension drops. But then the one thing I fear most begins: muscle degeneration. Because the nerve loses its connection to the neuromuscular junction. Why I'm not in a wheelchair yet, and why I'm deeply grateful: mirtazapine and probiotics kept the immune response against the fungus active. The fungus was allowed to continue growing, and at some point became so large that the tension stayed permanently high, and eventually it became too much after antibiotics. Nicotinamide riboside also had an effect, whether on the stomach lining, the immune system, or directly on the fungus, I don't know. TUDCA may have reduced stomach acid, which currently increases my muscle pain. At some point, the mycotoxins became so overwhelming that the T-cell cross-reaction against motor neurons subsided. Today, my immune system is so weakened that styes form on my eyes, and the skin barrier on my fingers is so compromised that even simple bacteria can penetrate and cause boils. Now I'm facing a decision. Do I let the mycotoxins continue to suppress my immune system? Or do I try to eliminate the fungus with biofilm disruptors like biofilm defense, knowing that this might trigger full onset of the muscular disease? Because if my theory is correct, then after the immune response fades, only one thing follows: irreversible muscle weakness, which already began in 2021 with my foot drop. Conclusion. What I want to say is this: I believe that my story, my observations and experiences, can help us rethink ALS and its potential triggers. At least in those individuals for whom fungi and mycotoxins play a decisive role. Even if I may never be able to prove that I actually have ALS, and even though the fungus, apart from its mycotoxins, is incredibly difficult to detect, there are now more and more studies investigating exactly this: fungi as a trigger for neurodegenerative diseases like ALS.